Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing what we feel is a great opportunity for you as an agency, whatever role you're in, to have as a part of your portfolio, not only for the upcoming 2022, which a lot of folks are talking about now, but for some things that we can do now as well. I am comfortable in the fact that most of us have bills to pay in the meantime. We're going to look to make certain that we take care of that with part of today's presentation. The presentation itself is being recorded. The link will be posted on our website at premiersmi.com, as it says here down at the part of the screen there, and we'll be on our YouTube channel, and we will send out follow-up by email to everyone who's expressed interest in today's section or session. You'll notice that there's a section for both questions and chat. We ask that you put your questions in the question box. We find that we cover them mostly during the course of the presentation, but we will make certain that you have the information you need to pursue a good producing environment for you and for Cigna in your market. With that, let's do a little bit of a level set as to who Premier is as a startup. We're a national marketing organization licensed in all 50 states, founded in 1968. That's part of the Integrity Marketing Platform. We have offices across the country, acting as an insurance wholesaler, working through independent insurance agents such as yourself to deliver programs to the Medicare beneficiary population. The contracts we offer are at the highest possible commission levels, with recruiting contracts available. It's important to note in the MA world because those maximums are set by the government. We do have a full portfolio of products to help you in the pursuit of your business, with a Medicare Advantage portfolio that includes the national carriers and many of the strong regionals for you in your market, with that philosophy carrying over into the prescription drug arena, the standalone PDP world, where those programs are available to you through our organization. Our Medicare supplement portfolio is very large and robust. We have a ton of material that can help you be successful, so we can address the needs of the entire Medicare population and cover them with ancillary products as well as the need arises during the course of your discovery process in discussing programs with your prospects and clients. When we look at the Medicare market, big market, looks like a huge market exponentially as we go into just aging in, but we must keep in mind now, with different circumstances, changing world, the pandemic that we've had, we have a number of folks that have continued to work and are deferring their Medicare benefits, but that is more than made up with by the 15% of the Medicare population that's under the age of 65. And they have needs we need to address. Health circumstances, challenges with their budget upon occasion. We need to make certain that we can address any choice that they make in their coverages for the Medicare program. Because frankly, they don't have to do a thing. They can even defer Part B if they choose to do so. Most don't, thankfully. Many will pick up just a standalone Part D program to deal with prescription drug costs, self-insure for some of the medical that's not covered by Medicare. But we have a number of folks that are actually picking up the difference there with Medigap policies, standardized, modernized Medicare supplements, but an increasing number, and according to DEFT research, going to change some of the future slides here, almost 40% of the Medicare population is in a Medicare Advantage program. So we want to make certain that we address those solutions that we have in each of the categories of folks that are, while they're choosing when they first come into Medicare. And so we offer an acronym guide to help you speak the language that's necessary. It's amazing how we fall into the habit of assuming that people know what we're talking about. And so it's important for us, if we run across an acronym, to make certain that folks realize what that entails and how it goes through, because it affects the election periods, the SEPs. We're looking at some of that for the 2022 season already. And then, of course, other special election periods that come as part of the regulations we have in the Medicare world. And that includes additional new SEPs for things that are affected by weather circumstances during certain time periods, those sorts of things. And keep in mind, this too will come to you as part of the follow-up to the presentation, because it's important for us to reach out to these people. Kaiser Family Foundation tells us that the majority of people on Medicare don't examine their options annually. And with a review here in the next few months, we can still positively affect the population that may not understand what's going on or really need help comprehending the information that's out there, because they're not using the government sites even. So some of the things that we can do as a marketing hierarchy is help you with additional software to address this population that's not visiting about their programs or reviewing them manually. Keep in mind too, we need programs that are able to help us pivot, because we may have an in-person meeting with an individual that needs to be virtual or vice versa. And so we need to have the software to do that, and realize that the population that we're speaking with also has an increased skill set when it comes to doing things electronically. It's part of the new normal. They've been trained by doctors, dentists, even their faith, a celebration of their faith has come through the computer or smartphone, and an increasing number of folks are doing that now. So what we have today is a presentation that will help you with one of the lead dogs in the industry. You know, it's the whole, we're pulling the sled from the front. We've got a great company in Cigna that's going to help us moving forward. And so we've invited Ms. Kelly Vila to come on and visit with us about the programs that are available through Cigna. And so Kelly, this is the handoff piece of it. Ms. Kelly is
Thank
the
you.
National Director and Broker Strategist for Medicare with Cigna. And oops, I had that started, and there we go. We're turning the screen over to you. And Kelly, now if you have that, you can pull up your presentation. I have it as well in the event that we have those circumstances that don't work. And here we go. You see that?
Yep.
Okay. So we're still seeing the spacer screen. Yours should pull up shortly. And there we go. Thank you. I am going to be silent now, and Ms. Kelly, take her away.
All right. Thanks, John. I love your analogy about the sled. So that was good. And I appreciate you allowing me to come in front of your agents today and talk a little bit more about Cigna and who we are, where we're going, and how we can help you grow your business along with what we're doing on our end for growth. So thanks for having me today. I appreciate it. I'm going to start with a little bit of a deeper dive on who we are and just paint a picture. I know coming into Cigna, I've been here now 2 years. I came in and started just learning more and more about the company itself. I was on the broker side previously, and honestly, I had no idea of the strength of Cigna, what was going on behind the scenes. So I'm really excited to take that perspective that I had being a broker and applying that to today to help you guys understand it a little bit more. Okay, so first off, let me make sure everything's working here. Cigna, who are we? We are more than just Medicare Advantage. Cigna, we went 2 years ago to one brand. So we're rebranding as one Cigna. You guys may know us as Cigna HealthSpring, but unfortunately we dropped that HealthSpring 2 years ago, and we are now just branded Cigna. And the reason for that is because we realized we had leverage across our organization, and it was time to stop working in silos. So if we just look at our U.S. commercial business, we serve approximately 14 million medical customers across the U.S., plus a diverse set of public and private employees across our commercial segment. Then we have our Medicare Advantage products, getting ready to have a 27-state footprint in 2022. And then we also have individual and family plans as well. Our IFP plans are available in 10 states across the U.S. right now, with plans to keep expanding our marketable footprint there as well. So as you can see, we're more than just Medicare Advantage. And when we take and bring all of that together, the power of our brand is what's going to really help us accelerate. Okay, a little bit deeper dive. Let's just look at some numbers. This is more of a vivid picture of us now as not only a U.S. company, but a global company. Cigna is global. We have 180 million customer and patient relationships around the world. Mental and behavior health care, which is one of our guiding principles here, how important that care is and that we offer that for our whole health being. We have a network of 175,000 mental and behavior health care providers. That network has grown 70% since 2016. We have 67,000 contracted pharmacies. Medicare Advantage, like I said before, 26 states plus DC, plus our prescription drug plans in all 50 states. So if you look at this by the numbers, it's what we'll use to really leverage and to expand our business and in turn, hopefully expand your business as well through our partnership. Okay, so let's talk about that accelerated growth. With all of that being said, taking the power of our brand, our products and relationships, we're going to really leverage that to accelerate. It's truly an exciting time to be in the senior business. You know, we have an aging population, fantastic products and services. It's really an opportunity for all of us to make a difference in our loved ones' lives, our clients, and the communities we serve. So in parallel to all the incredible work that you guys are doing out there in the field, we want to let you know that we have a track record as well as delivering value to our mutual customers, to employees, shareholders, and all of our partners, including you. We're building on that foundation built from our legacy Medicare Advantage HMO products, which we're going to talk about here in just a minute. We're going to leverage our commercial footprint for exponential expansion. We're going to take our value-based providers of choice that we have deep relationships with and our provider partners that can offer more affordable network solutions and options for our customers. Medicare Advantage at Cigna is a strategic growth platform for Cigna. And since it is, the enterprise has dedicated the resources, both human and financial, to help ensure our success. So let's talk a little bit about that opportunity we all have in front of us. By 2025, I'm just going to focus on the last bullet here, there will be approximately 72 million Medicare eligibles. We all know we are in the right business at the right time to truly impact lives and make a pretty decent living while we're at it. Okay, so let's get into a little bit more about why Cigna. And really what I want to talk about here is just to go a little deeper, why we believe that we're the number one company for you to keep and do business with when it comes to Medicare Advantage. Okay, provider engagement. We know in the Medicare Advantage world that provider engagement is crucial to the health, the well-being, and the success of our business. That's our core foundation. We have improved affordability for our customers by making multi-year investments in our networks and benefits. In fact, 90% of our plans are in the top 5 on the CMS Medicare Plan Finder. And 85% of our customers are in value-based provider networks. That's our foundation. That's what we're going to continue to grow on. The more value that we can provide to our customers, the better positioned you will be to grow and retain your Cigna book of business. In fact, in the last 5 years, our Net Promoter Score has increased more than 20 points and on average ranks at about 74, which is really an industry-leading number. Said a little differently, that means 3 out of 4 people would recommend Cigna Medicare to a loved one or a friend. So if you're not familiar with Net Promoter Scores, I'll just give you a little context. and we call it NPS score. The NPS score for Apple computers is 64, and that's considered very high. So 74 is really industry leading. It tells you that you can trust us with your customers, and those customers will refer to you. Okay, let's talk about our quality clinical outcomes and what that means to you. So in 2021, 88% of our customers are in a 4-star or higher rated plan. You guys are all well aware how star ratings really affect Medicare Advantage plans. It affects the quality of care, all of that. You know how important those star ratings are. We're the only national carrier with a weighted average of 4.5 on our stars measures. And we're the only plan that showed improvement in 2021. Why am I emphasizing on this? Because what this means to you is it means you can trust us with your customers. It means your book of business. It means growth in your Cigna book of business and confidence that when you put your customers there, we're going to take care of them. Okay, so all of that, the foundation, taking our one Cigna, leveraging all of our platforms, has gotten us to where David Cordani, our president and CEO of Cigna, publicly committed to a 10 to 15% average annual customer growth in our Medicare Advantage segment, which translates into a significant opportunity for you as well. Here's some of the things that we're going to do to achieve that commitment. It starts by identifying our expansion and building out the networks we need to support our growth. You can have a great product, you can have great benefits, but if you don't have that strong provider support behind you, your plans are going to fail. So we're going to take that commercial footprint where we have a very strong established relation and leverage that to continue to grow our geographical footprint and our provider network. We'll continue to build out our product expansion. As we continue to expand into addressing 50% of the Medicare eligibles by 2025, we'll pull upon our HMO foundation and then layer onto that with PPO, D-SNP, and chronic SNP products. And finally, our benefits. We continue to invest and roll out products year over year that are both affordable and predictable. We really want to be the champions on that. We want to deliver simple healthcare solutions, but most importantly, we want to create stability. We don't want to come in and roll out a product that captures the market share and then the next year have to disrupt that product. So we're continuing to invest and roll out products that we can sustain and that are affordable and predictable for our customers. All will add to our current 3.5 million Medicare customers across all of our products and services. So we have a lot of work to do, and we really need your help to get there. All right, so what's in it for you? I'm going to talk a little bit about why choose us. I told you a little bit about our background, the core foundation, what we all here internally work towards at Cigna, the commitment that we have to the growth. But here's some other reasons for you, what this means to you as an agent. We have broker service managers in every single market. Those managers, we are committed to supporting and growing and keeping them local. We want them to be accessible to you. And by having access to these guys, you're going to have access to that local market knowledge and support. They're the experts on the product. They're going to tell you at a granular level where you live, what our value proposition is, what our strong selling values are, and really give you that knowledge and support. They'll assist with helping you with business planning, marketing, recruiting, building out that value proposition, understanding which products were well positioned, training, coaching. Right now, our broker managers are scheduling both virtual and in-person trainings in all the markets that we serve. So you have a solution to either train virtually like we're doing today, or if you prefer to go face-to-face and you're comfortable with that, they also have sessions for that. There's a lot going on right now. We're getting close to AEP. These guys can fast track you with everything about Cigna right there in your local market really quickly. Issue resolution and escalations. If you're having issues or things that you need resolved, they have access to everybody within this organization to quickly get your matters escalated and resolve any issues. They have access to kits and enrollment materials. So local market support, we're committed to that, and we're committed to continuing that year over year. Okay, a couple other things. In addition to that, right, we've got competitive plans. I already said the majority of our plans fall into the top 5. In some markets, they fall into the top 3 on the Medicare Finder. They're competitive. They have rich benefits. They meet customers' needs. We have tools. We'll talk a little bit about the tools here to help you promote, grow, and manage your business. We have ease of enrollment as well. I know Premier provides you a huge platform on virtual tools and resources. We also have them as well. And we have resources that help support Premier in that as well. We also have a designated Cigna agent resource line. We call them our Carl team. We'll talk a little bit about them. So our value proposition is partnering with providers to keep your customers healthy and just a relentless quest to make healthcare more affordable. And that shows by our industry-leading Net Promoter Score. Okay, so let's talk a little bit more about those tools and resources. What exactly is it that we have that would be of value to you? So first, I'm going to kick it off right now with virtual tools. It's a reality. It's our reality today, as John said, right? The landscape has changed. It has accelerated into the virtual world. We have virtual tools. We have basics of Medicare presentations. We have Cigna Medicare video learning series, things you can use that will make you an expert in the field. We have social media trainings. Our social media training, I really believe is one of the best out there. You can sign up for our training. We'll take you through the basics, how to even create a social media presence, influencers to follow, all the way down to providing the content and access to the media that you need to really have a social media presence that's professional and effective. We have a Cigna Digital Business Reply Card. It's basically a lead that's virtual. You can put it on your Facebook. You can put it on your website. Customers can fill out the business reply card virtually, and you have a compliant lead that you can call upon. We also have DRX platforms, personalized URLs. These all provide pricing and enrollment information electronically. You can send via email, social media, website link, truly giving you the ability to virtually enroll from anywhere. Okay, where can you find all of these things? I'm going to talk about Cigna Medicare Producers University. This is going to be your one-stop shop for all the resources that I've talked about, that I will be talking about. This is the most utilized portal that has your annual certification training. It has pre-sale, sale, post-sale resources, agent communication. It has the social media trainings, all the trainings that are in the local markets, whether they be virtual or in person, you can sign up for, all through our Medicare Producers University. So I'm going to show you a little bit of a deep dive on how to navigate this, because this is really going to be your number one go-to. So first of all, when you enter in and log into the Producers University, this is going to be the first system you have access to. If you are not contracted and certified to sell Cigna today, when you work through Premier and you get contracted, you will get a link to this Producers University, because that is where you're going to find your certification. So when you log in, this is the first screen you'll see. You'll see the My Learning tab. That's where your certifications are. If we ever get into a little bit of compliance trouble, you'll have your remediation training there as well. You can view your transcripts, your completed courses, and then instructor-led training. This is where you're going to find national, local training led by an instructor, not just a recorded webinar. And then the resource library. The resource library is just a huge tank of everything that you need to know to sell our products and the tools and resources that go along with it. The resource library looks like this. As you can see, you can look at market specific, you can pull pre-sale resources, sale resources, WebEx recordings for the Medicare 101, and you'll also find your agent communications. This is what it looks like when you click in on, let's say, the pre-sale information. You'll see there's an arrow you can click for the pre-sale 2021 one-pager sell sheet. This is where you should go immediately. This is a quick hit, one-sheet page for every single market that we're in that tells you the benefits and the selling proposition in that market. So just a ton of resources in this resource library. Okay, our next platform. This is Cigna for Brokers. This is where you will manage your book of business. eAgent, some of our legacy Cigna brokers, remember eAgent. That is a thing of the past. Cigna for Brokers is a much more proactive CRM for you to utilize and manage your leads and your book of business. This is where you can check your enrollment statuses and view your entire book of business. Okay, this year, we made updates and enhancements to our provider search tool. I'm including this here today because after AEP, we conducted some roundtables within each market, and we heard from you guys that our provider search needed some help. So we took that back and totally redesigned it. It is faster to find what you're looking for and easier to use and navigate. I wanted to call that out today. If you haven't heard, because we've been communicating, we have updated this online provider search tool, hopefully bringing you a much more user-friendly experience as you hit that AEP trail this year. You'll get full screen maps, better options for saving and printing. It'll lay out a design depending on the device that you're using, so it improves with the mobile view if it's a tablet or a phone. It has an easier search function. You can search for several doctors at one time and not lose what you had put in there previously. So quickly wanted to call this out to you guys so that you knew it's out there. We heard you and we made the update. Okay, then we have our marketing shop. This is your one-stop shop for all of your sales material and customized documents. You can go in and pull down AEP, postcards, flyers, product information, personalize them with your own information, your picture, save them as a PDF and print. This is also where you'll get sales kits if you need sales kits for out in the market. It's the marketing one-point stop for all the materials that you need to market your business. And then lastly, our Carl, our Cigna agent resource line. Carl is here to help with everything that we just covered and things that we haven't covered. They can help you with password resets, commissions, licensing. They can look up doctors for you if you don't have a connection or your phone's not working. They help you verify Medicaid and Medicare. They can help you with updating primary care providers. Anything that you need when you're working with Cigna and selling Cigna, this is your go-to source for any of that information. Okay, and then just to give you a little sneak peek of what's coming that we're really excited about here, single sign-on. So again, after those roundtables, we heard you. Too many systems. I just covered Producers University, Cigna for Brokers. I covered the online provider directory, our custom point marketing materials. In the next 30 to 45 days, we'll be rolling out a single sign-on. You go into Cigna for Brokers, and as you can see here, you'll have access with a quick link that will take you to all the tools and resources that we just talked about. So we're really excited about that. Medicare, Medicaid eligibility, self-serve will all be available through this single sign-on platform. So really excited. Watch your communication. Like I said, 30 to 45 days, we'll be rolling that out. Okay, so before we get into products, because I want to touch on selling opportunities today, and then give you some exciting news for 2022. But before we do that, I'm going to tell you about some opportunities we have in front of us right now, together with Premier. So Cigna participates in retail programs. We're in the Walmart program. We're doing the Kroger program. I know that's new and just now rolling out to everybody. But we also have our own Walgreens program. We have a dedicated retail team that continues to drive partnerships across our Medicare Advantage footprint. One of the newest relationships we have, if you're in Texas, we have some H-E-B stores that we manage. Like I said, the Walgreens. The things that we manage are managed by our local broker team, another value add to that team, and there's no cost to you to participate in those Walgreens or H-E-B stores. And then, of course, we do have the national Walmart and Kroger that we are a participating carrier. So many opportunities out there in the market with us. Social media training. I encourage you, if you haven't done it, go do the training so that you can unlock access to pre-approved, customizable, Cigna branded content that generates leads, helps promote sales meetings. It is your most economic way to promote yourself and your business. This is all free. You will have access to things that are pre-approved, content that is health and wellness related. It gives you the presence on your social media that shows you as an industry thought leader. These health and wellness articles, I tell you, it goes way beyond just Medicare 101 and what's A, B, D, and C. They're on whole health, written and approved internally by us for you guys to use. But you can't have them unless you attend the social media training. You'll get ongoing newsletters to keep you in the loop on industry trends and additional content that's constantly being added to download and use so that you can refresh your presence. This is a free training for you. It unlocks all of these things that you can immediately start using to help boost your sales on your virtual presence. And then with Premier, we have the integrity partnership. So Cigna, Premier, integrity, we appreciate everything that Premier does for us, and we also leverage the relationship with integrity and what they bring to the table. They have a marketing firm, Thomas Arts, that is a leader in Medicare Advantage marketing, and we have partnered with them to do marketing campaigns to generate leads specifically for Premier agents during right now and AEP. And it's a partnership that we plan on continuing. So there's a ton of opportunity for us together through Premier and integrity to really help you kickstart your Cigna business if you haven't already done so, or to continue your Cigna business if you're already contracted. So let's get into what can you sell right now. So if you're contracted certified, I struggled with this. We're in 25 states. How do I show you where our strengths are when we have 25 states? So I think I came up with a good plan to do so. A little bit about, we went into 2021 with those guiding principles, market stability, our 2020 benefits. We worked to really maintain 91% of the renewing plans that we had stable or declining premium. We have a zero premium product in every market. 99% of our plans have dental coverage. 99%. That 1% is a plan in Arizona. 97% of our plans have vision. 82 have over-the-counter benefits. We have excellent products out there, along with ancillary benefits to go along with it. So this is what I struggled with. How do I show you where we're selling really strong so that you can go out there and help with your growth and our growth immediately? So I'm going to start with our footprint for 2021. I told you about our 10 to 15% growth that we committed to for 5 years. Well, that started in 2020. So in 2021, we expanded 23%. We expanded into 5 new states. That's what you see in green. So this is where you can sell today. These are our existing Cigna Medicare footprint based on the expansion we just had. Okay, this slide's a little busy. I'm sorry about that, but this was the way that I thought, how can I tell you and really focus your attention to where we're strong. So I went in and I looked at all of our sales and I ranked each market. So Texas is number one for the quantity of sales. And then what I did is, Texas is a big state, so let's narrow it down even further. So Houston is our number one selling market in Texas, Dallas being number two, and the Rio Grande Valley being number three. Product. I wanted to highlight what we're seeing with product. So the PPO product that we expanded in 2021 is selling at a pace almost even with our HMO product. So I want to say our PPO is around 44% of our total sales in Houston and Dallas. That is strong. That's telling us we're competitive there. And if you're located in those markets, definitely take a look at us. John is going to share this with you afterwards if you're interested. I'm not going to go through all of them, but this is really where you can go out and start selling us today and be successful. Also lump in Mississippi and the Florida Panhandle. Birmingham, Mobile, and Pensacola are our three top micro markets. And I highlighted Pensacola because we have a 5-star plan there. So we have year-round selling opportunity in that Pensacola, and it is showing in our numbers. I also wanted to jump down to our PA market, Philadelphia, which also includes New Jersey. In the Philly metro area, we have the number one D-SNP in that market, and it is selling like crazy there. So Philadelphia, Southern New Jersey, two strong markets, but Philadelphia and the D-SNP is what is really, really strong. Florida, I have Florida called out here. Florida is number 11, but that doesn't mean it's not selling really well. It's just one of our newer developing markets, so we're building our footprint there. Daytona, Tampa, and Orlando are all very competitive and have 5-star plans. So don't discount Florida. And then I called out Utah. Utah was a brand new state. If you remember on the map, it was one of those states in green. We dropped a PPO product in the Salt Lake City and the surrounding counties that has a buyback. And we also got every major network anchor in the Utah market. That market is selling at 3 times our projected goal. It just is on fire. It was the way that every expansion state should go. It's a dynamite market. So I hope this gives you some directional approach on where we're strong and where we can have some really immediate successes as we move forward. Okay, so let's move to 2022. What's coming? We have a lot to talk about here. So I want to make sure that we get it all because there's some exciting things on the horizon for 2022. Well, first of all, our footprint. 29% this year. If you remember, we were at 23% in 21. We are expanding 29% for 2022. We'll be adding 3 new states, Washington, Oregon, and Connecticut. But in addition to that, we'll have 23 new D-SNP counties, 152 new PPO, continuing to go with our commitment of growing the PPO, growing our HMO markets and our D-SNP markets. We'll have 119 new HMO counties and 108 new MA counties, 29% expansion. Quick overview of what our national product looks like. Again, you're going to hear that word, stability, in both benefits and premiums. Minimize customer disruption. That is all we talk about here at Cigna, is we want to minimize that. We want stability. We want simple solutions. So we have high value, low cost solutions and PPO choices. We improved our D-SNP options and focus. We're focusing more heavily on our D-SNP product. And we expanded some of these supplemental benefits that I'm going to show you that focus on social determinants of health that I'm really excited to share with you. And continued expansion of virtual benefits. So our telehealth, We have physical therapy that you can do virtually. Just bringing the care to where our customers want to receive it. Okay, some new things, new innovative benefits. We have a Cigna cash card rolling out. We have a healthy foods card. We have in-home support, Part D LAS cost sharing reduction, and Cigna insulin savings program. I'm going to deeper dive into some of these, starting with our Cigna cash card. In select D-SNP plans in Florida, Mid-Atlantic, Philadelphia, Connecticut, we will have a Visa debit reloadable card. This gets funded monthly to range from $25 to $50 every month. The debit card can be used anywhere Visa is accepted. There are some exclusions. They can't buy firearms, tobacco, or use at casinos. But this Visa debit card can be used to pay bills, doctor copays, groceries, and the funds will roll over month after month and be good for 3 years. Really excited about the Cigna cash card. Papa Cares. Papa Cares is a program that's near and dear to me, and I'll tell you about that in a second. It addresses loneliness and social isolation by connecting what we call Papa Pals with our customers for companionship. They can help with grocery shopping, medication pickup, doctor's appointments, technical guidance, light housekeeping. This will be available for our Houston customers, Alabama, Northwest Florida, Colorado, New Mexico, Oregon, Salt Lake City. So a pretty wide span will have this benefit. I'll tell you, 20 years ago, I actually was part of a program similar to Papa Pals. And I had a senior companion, is what we called it, the senior companion program. That I was the one helping, right, with the grocery shopping, the medication pickup, the doctor's appointments. I'll tell you what, myself and my children will never forget the impact that this woman had on our lives, and vice versa. We became very close friends. She did have a large family, but as we age, if you have children, it never changes. You don't want to burden your children. So we were able to come in and help her with all of these things that she didn't want to burden her children with. So I'm telling you, this Papa Cares is near and dear. I was really excited to see that as part of our benefits because I know the impact that that can have. The Cigna Insulin Savings Program. Stable, predictable insulin prescription copays. This rolled out last year. We participated very little in that last year because we did have some good plans out there that our cost share on the insulin was not very high, but we are participating this year in select plans, which will offer that $35 per month for insulin. Dental, huge change this year in our dental. Cigna Dental Health will administer both our dental allowance on our PPOs and our dental benefit on our HMOs. This is huge, having this vendor, Cigna Commercial Dental. So that is across the U.S. This network just exploded by having Cigna administer our dental benefit. So anywhere you go, if you were a Cigna commercial customer, you can now go under our Medicare Advantage because they will be administering our network. So we are really excited about that because we know one of the biggest problems with dental benefits on Medicare Advantage plans is actually finding a dentist that will see you. So huge network change for our dental benefit. Okay, what else is new? We changed our iMed vision, supplemental vision vendor to iMed. That will be in all markets. We also think that this is going to give a better opportunity to have a larger network. It's all about utilization. We want them to utilize their plan, take advantage of these benefits. So we're always looking for ways to make it simpler and easier for them to do so. Inclusion of annual physical exam in all markets on all plans. Telehealth, speech therapy. Virtual speech therapy will be offered through contracted providers. Cigna Healthy Food Card. This is a grocery card that is loaded with a monthly allowance that could be used for the purchase of grocery items. It'll also include manufacturer coupons for healthy food. It'll have participating retailers. The healthy food card, the funds will not roll over month to month because the whole plan is we want them to use it. We want them to have the ability to purchase healthy foods and do that consistently month over month. We'll also be participating in the Part D LIS cost sharing reduction. This eliminates the cost sharing of those Part D drugs for customers who qualify for that LIS extra help. So they will have a zero drug copay benefit on all Part D drugs covered by our formulary through all of the Part D coverage phases. So some pretty exciting things coming for 2022. We're really excited about them. Just think that there'll be great opportunities for you to grow your business, come alongside Cigna and sell these plans. Okay, I'm going to talk about what we're continuing. So these are in the market now, and they will continue. We have plans with Part B givebacks. In all of those markets you see listed, those will continue. We will continue with that Part B giveback. Quad zero. I think we coined that phrase, Quad zero. In 2020, we rolled out these products that we called Quad zero. They were zero premium, PCP, specialist, tier 1 cost share, RX deductible. So I did have brokers ask me all the time, can you really sustain that? Well, guess what? We're going into 2022 and we're sustaining our Quad zero because, again, it's all about the stability. Our adult daycare reimbursement will stay on our plans this year. The supplemental acupuncture reimbursement. Of course, the telehealth, access to medical services virtually, and our dental allowance. So we have two dental benefits. One that we rolled out in 2021. Allowance has an annual limit that gives them the flexibility to go to any dental provider that is approved to accept Medicare patients and has not opted out of Medicare to go see that dentist and have that dentist build Cigna up to their annual amount. So a very flexible allowance with a flexible service and provider choice. So the amounts do vary by market. And again, these are more so on our PPO products, and they will continue into 2022. We'll continue with our post-hospital meal benefit. It offers 14 meals post-discharge from an acute inpatient stay. So it's really to help them transition to home. So they go home and they may not have the support, they may not have the energy or the ability to actually make sure that they're eating properly. So it offers 14 nutritious meals after every post-discharge. We will have the health and wellness resources. We are expanding out on this because of where we're at today. It is hugely popular. MyCigna.com has a variety of health and wellness topics that they will have access to. We'll send them reminders to go and look at these resources. It talks about diabetes, healthy living, exercising, you name it, there's a topic on it. We'll continue our ESRD meal program. Our telehealth, behavior health. This is a big commitment for us because we believe that behavior health is important as physical health. We'll continue with our zero cost share via MD Live and with those contracted behavior health providers that we do have, an important benefit for us. The physical therapy, telehealth. This actually offers customers access to virtual physical therapy sessions at zero cost shares. I actually saw how this works because in my brain, I couldn't figure out how on earth do you do physical therapy virtually. And what it is you have a coach and you also have, the best scenario is the member has somebody with them and the coach on the other line is helping that member and their companion to work through the physical therapy, whatever that is prescribed. So it was a pretty neat thing to watch and see, and really connected the dots for me. Okay, so overall, 2022 plan outcomes. Again, we'll have zero premium product offerings in every market. 84% of the plans will have stable, declining premiums. 99% will have zero PCP cost share. Again, 99% will have dental coverage. 98% up from last year will have the vision benefit, and 85% will have the OTC benefit. And 100% of our plans will continue to have that zero mental health office visits. Again, with that focus on that mental well-being is so important, just as important as physical, to really treat the whole mind and body. Okay, well, that was a ton of information. I really, truly hope that I provided you with some good nuggets on where you can partner with us today, how to partner with us, what 22 looks like, the exciting things on the horizon with Cigna, and really, truly help this be your best-selling year ever with Cigna. We want to help you with that sled, as John said. We want to be a partner of choice, and your success is our success, and I think together we can both succeed beyond our wildest dreams with the opportunities we have in front of us. So thank you very much. I'm going to turn it back over to John to talk a little bit more about next steps and how we can work together. So thanks for having me today.
Awesome. Thank you, Kelly. There are a couple of questions we need to address. One is kind of technical on my part. Yes, this presentation is being recorded, and you will receive a link to that recording. It'll also be posted on our website, premiersmi.com, and on our YouTube channel, but it will be sent to everyone who has raised their hand with interest in today's topic, in our opportunity with Cigna, and it will include a PDF of the presentation in its entirety as well. But the more important question here, not to denigrate any question that's posed, but is there's some questions as to the actual sign-on, Kelly, for the different websites. You mentioned the singular sign-on, and then another person had asked about, is there a different URL than the current e-agent piece? So we'd like to delineate and lay out and just have that website URL. And so we will make certain that that comes as part of the follow-up. But Kelly, could you orally give us that information?
So the single sign-on, what was the question related to that, John? Just more information on it?
Just what the URL address is.
Okay. So our Cigna for Brokers will be where you go today for managing your book of business, and it will be where you go in the future for the single sign-on. I can get you that URL and send it over to you, John, that you can share with the group. If they are a contracted, ready to sell agent, they should have access to this system. So the URL should work, and they'll be able to log in and create their account. And if they cannot, then we can help them get access. So I'll send out a link with more instructions that you can forward to the group.
Awesome. I thank you for that. And that way we'll have it for everyone moving forward. Another question just popped up, pardon me. And so Joanne, that'll be that current sign-on, and that is the information that you'll need to go for future information as well. So that's the joy of a singular sign-on, as I comprehend it. Cool. Awesome. I thank you, Kelly. I'm going to pull control back and speak to some of the next steps and some of the things that we can help you with in accessing these programs with Cigna Medicare through Premier Marketing. We do have a program that can help you do create an agent profile and have that information available for multiple programs, all part of the push for fewer pieces of paper or more green access, and make certain that you have that information for different programs. We also offer discounted E&O to qualified agents. What makes you a qualified agent? Well, you got a contract with us. And this is the program that you can use to pull in information that satisfies the requirement that carriers have to represent their programs with errors and admissions coverage. It's not adding you to a blanket policy for one program and then you wondering how you can deal with the rest. You own the program, it takes care of you. We also have bundled CE programs to make certain that we can help you keep your license in play and add to your own personal benefit through a modified guarantee issued DI program that you're paid a commission on yourself. So it's a great way for you as an independent agent to protect your ability to earn. Much as where today's presentation is being recorded, past presentations are available to you as well and includes information about retail programs that Kelly referenced and other ways of accessing the public to put you in front of the people that are necessary for you to succeed. You got to have qualified prospects. This is ways in different programs that can help you, including working with providers, working with centers of influence in the community, such as faith-based organizations. So that's all out there for you as well. You also have the access to Medicare Center. And this is a program Kelly referenced briefly in her presentation, where you have access through a singular sign-on with our organization to have 3 programs available to help you work with the Medicare population. And that includes engines that are powered by Connecture, by Sunfire, and CSG. It also comes with a CRM to help you manage your book and do that all-important compliance work of collecting that scope of appointment to delineate what the conversation with that individual is going to be, which is a great tool to help you cross-sell as well. It also gives you the ability to store that information for that 10-year period and make certain that we keep you in compliance that way as well. We want to make certain that you have also a tool to compare programs side by side. This allows you to do so with 3 carriers. And that all important fill in the blanks program that's available through CSG. We'll have a link to that demonstration of that, how to work that in the follow-up. We do also make certain that you have access to all the incentive programs that are out there with different carriers. Keep in mind for MA and PDP programs, max comp is set by the government, but the other programs that are offered through Cigna as well will help you qualify for some of the incentives they have in play. And then, of course, the premier incentives that we do on an annual basis, which last year was going to be a cruise, that turned into a whole bunch of cash for a number of individuals. Some of the things we're going to do to help get you in front of people, you have a custom list available for you if you're a friend of Ma Bell. Obviously, you can't cold call for MA or PDP programs, but there are also different programs that Cigna offers to help put you in front of people. And as Kelly demonstrated today, some of the really cool things they do with social media that we can help with as well. But those programs to help you be an influencer in your community, work with Cigna for some of the programs that they offer. Kelly mentioned the different programs they have in retail, great opportunity to get in play there. And even though Cigna is participating in Walmart, they do have their own program, as Kelly mentioned, that's available without those dollars up front. Those internet leads and direct mail programs that we have, the direct mail support is based on production, but it deeply discounts the cost of those programs. And you have 2 you can qualify for. The health programs that we discussed today and others that are part of that category. And then, of course, final expense as well. We work through preferred lead vendors to make certain that we handle this efficiently and compliantly, so it's there for you to use. We do also have a couple of programs that are for direct mail response. So you don't have all the monies up front necessarily that are necessary to direct your own direct mail program, but we address the different responses that come back. Obviously, those aren't quite as fresh because you aren't delivered these immediately when they come in, but they're non-contacted, fresh leads that vary in cost. These are some programs that are available to you that are, well, the prices may vary according to the area you're in and what responses they're having. That internet program that we offer are 4 leads off of Facebook. There's one for final expense and Medicare leads. We can get you additional detail upon that, upon request for those programs. So all said and done, we're just a smidgen into the noon hour here in the Central Time Zone. But we go through all this because we want to help you grow your business and be that partner for you to present programs for key carriers like Cigna. Keep in mind, if you are already contracted with Cigna, as it appears many of you have that contract in play, we want to make certain that we can leverage that current contract for the remainder of this year and in 2022. If you are not contracted, we will get you the information that's necessary to put that in play so you can have the certification out of the way, applying AHIP to the programs. We have an AHIP reimbursement program for agents that are direct to us that we work with. That can be very helpful for you as well to get that money back that you're out of pocket for. Obviously, if you go through Cigna, you get the discount on that up front, and we can help with the reimbursement of the balance. It's a program that's, we feel, a necessary part of your portfolio in the markets in which the Cigna is present. And it is then a opportunity for you to respond to that line from the John Wayne movie, The Cowboys: slap a piece of bacon on a biscuit, saddle up, let's ride, because we're burning daylight. You have an opportunity through the remainder of the year to make it part of your program, and we're asking you to do so. Keep in mind, you can contact us through our toll-free number at 1-800-365-8208. If you're working with a marketer, we'll make certain that the information is available to you for all these programs through that marketer relationship. If you haven't worked with us in the past, we'll take care of that, and we'll have a subject matter expert for you in your market help you with that program. You can also get the information through our website, as I mentioned, at premiersmi.com, and have that in play for you. I'm going to check questions really quickly. I think we've addressed everything that's there. That's good. So Kelly, we thank you for your time and the valuable information you've delivered today. We thank everybody who's come on the line and invested their most valuable resource with us today, and that's your time. We want to make certain that you have a strong return on that investment. And until we're able to speak with you and move forward with these programs, hey, we wish you good selling. Thanks so very much. And once again, Kelly, thank you. Watch for the follow-up that will come and the recordings that are there for you. And I talked over you as usual, Kelly. So thank you very much, and we'll speak with you down the road.